We're rolling. Excuse me.
Can you state your name and spell it, please?
Mona Hannah Atisha, MonaHannah-Attisaj.
So let's go back to when you found the lead levels in the children.
Mm-hmm.
How did that make you feel, and like, what was your first reaction?
So when I did the research that showed that there was more lead in the blood of our kids, I went through a roller coaster of emotions. I was heartbroken, devastated. I was angry. I was sad. So lots and lots of emotions when I found out that our kids were unnecessarily exposed to lead in the water, and ultimately kind of channeled those many really negative emotions into action.
So you eventually went and released the information to the public. How did the people in the town respond to that?
Oh, that's a great question. So I found this research, and then I publicly shared this research, which is not like how doctors and scientists are supposed to share research. We're supposed to publish them and present it at conferences, but that takes time to go through that peer review process. But every minute that went by was a minute that another kid was drinking this water. So yes, I publicly shared this research, and I think there was a wide range of kind of reactions. I think for a lot of the community members that I spoke with, there was like almost a sigh of relief. Like, we knew something was wrong. We didn't know exactly what it was. Thank you for putting words to the why. Thank you for kind of legitimizing our concerns.
Do you know what happened to those kids with the high blood levels?
So I'm still a pediatrician in Flint. My greatest joy continues to be taking care of our kiddos. So right when the water crisis happened, we knew that we would need to put our arms around our children and to really kind of follow them for a long time to make sure that they're going to be okay. So I can tell you about like how some kids are doing, but that's not what what we need to know. We need to know like how are all the kids doing. And that's where our work around the Flint Registry is. So the Flint Registry was set up to do longitudinal surveillance. So like, what does that mean? It means to follow kids for a long time to see how they're doing. When folks are exposed to something like lead, when young children are exposed to lead, and when young children are exposed to any kind of bad thing in their life, any kind of trauma, any kind of like adversity, which was a big part of the Flint water crisis. It wasn't just the lead exposure, but it was just this injustice that happened to our children, this betrayal, this loss of trust, this worry, this anxiety, this guilt, this fear. All of that was part of the water crisis. And the science tells us when kids are exposed to bad things early on in life, sometimes it doesn't present right away. Sometimes we don't see the consequences of those bad things right away. And we really need to kind of follow children over time, because sometimes those bad things present later on in life. Like a kid exposed to lead when they're like 1 year old, they might present with ADHD when they're 8 or learning problems when they're 12. So it's really important to follow folks for a long time and to continue to support folks. So the Flint Registry was created to do exactly that. It is supported by the Centers for Disease Control, the CDC. We're on like year 6 of the registry, and that effort is to see how folks are doing, and more importantly, get them supported into many resources to improve their health and development. We've been able to enroll about 20,000 people in the Flint Registry, which is amazing. And then we've made about 30,000 referrals to really important things like literacy programs and early childhood and trauma-informed care and healthcare, all these great things. And the big data from the registry is telling us a lot. It's telling us that Flint kids are amazing, as we know, but also that a lot of Flint kids are struggling. They're struggling to make ends meet. They're struggling with school. They're struggling with emotions. They're struggling with access to resources. And the good thing about the registry is that we're not just like learning about that, we're then helping those people. But with a lot of environmental problems, it's very hard to say the water crisis, that exposure caused these problems, because there's that time lag between the exposure and when problems develop. So that's kind of this, problem with all environmental conditions. You know, you may be a coal worker and you're exposed to bad things, but you don't develop lung cancer for 30 years. So it's very hard for us to say that these bad things that we're seeing right now in kids are because of the water crisis, or are they because of all the other really hard things that our kids in Flint are exposed to.
Okay.
What real quick while we're on this, before we move on, what are some of the specific things you've seen with some of your patients, if you can talk about that? Like what's the main things you're seeing that may have been a cause of the lead poisoning?
Yeah, I think the main thing that we are seeing in our patients is behavior and cognitive issues, and that's the most common things that you do see with lead exposure. Lead, impacts cognition. It actually drops IQ levels at a population level, and it can also cause behavioral problems like ADHD and other issues. So we in one last report that we had of Flint kids, I think over 60% of kids had ADHD, and needed other resources. Once again, it's hard to say, is this because of the water crisis, or is it because of all these other obstacles that Flint kids face? And I think also the most common thing that I see in patients is anxiety and worry, especially from parents. Like, is my kid's problem because of the water crisis? And it's just this fear of is my kid gonna be okay?
So what can we do to help those kids now as a community and everybody around?
Oh, that's a great question. There's a lot that we can do, and there's a lot that we have been doing. I am in awe of working in Flint every single day. This community has rolled up its sleeves to protect our children, and to make sure that they have the brightest future possible. I love this community. I love working here because of exactly that. This bad thing happened in Flint, but so many community agencies, moms and dads, and our kids have stepped up and said, we are not going to be defined by this crisis. We are going to be defined by what we do next. And in that sense, yes, what happened in Flint, the water crisis, is the story of this crime that was committed against our most vulnerable folks, but it's also this amazing story of resistance. It is an amazing story of how a community can come together to ensure that not just our kids have the brightest future possible, but that we make an impact across the nation. And that's the story that we need to share. That yes, there was a crisis, but because of what happened, we have built this model of hope and recovery, not just for Flint kids, but we have made an impact across the nation.
I'll jump in here again. What are some of the programs and the things that have led to that hope that I just heard you talk about there?
Yeah, so there has been so much that we have really thrown at our children. We have expanded Medicaid in Flint. So this is healthcare access that exceeds regular income and age eligibilities. We've massively expanded literacy programs from Imagination Library. Every Flint kid gets a book in the mail every month from the age of 0 to 5. We've mailed over 300,000 books. We've expanded early intervention, which is like home visiting for kids when they're very young. We have 2 brand new child care centers. We do nutrition prescriptions in our clinic. Every kid that comes in gets a prescription for fruits and vegetables. Trauma-informed care, expanded mental health care services. The registry is amazing in terms of what it's done to support folks. So there has been a lot that has been put into place to mitigate the impact of this crisis. And I'm going to share a couple of examples of how we've been able to help not just Flint. The nutrition prescriptions, which we do in my clinic, which is atop the farmer's market, every kid that comes in gets a prescription for fruits and veggies. And we research it as academics, is it actually helping? Do people eat better? Do they have more food at home? And how does it impact their behaviors? And it's been very successful. And because of the success of our little program in our clinic, to improve the nutrition of folks, which is really important for creating healthy kids, it has now become part of national law. Now nutrition prescriptions were included in the U.S. Farm Bill. So it is now a $40 million national program because of what we did in Flint. That's one example. Another example, so much of our work in Flint, especially around water, has informed policy at the state and national level. The state now has the strongest lead and copper rule to deliver safe water to people all over the state. And the Infrastructure Act, which passed at the federal level, invested in roads and bridges and internet and all these like really important things to improve our infrastructure. But it was also the largest federal investment ever in water infrastructure. And it included replacing the lead pipes across the country. Nobody knew about lead pipes before Flint. Like, some people did, but it wasn't an issue. But now it is an issue. And because of what we are doing in Flint, because of our advocacy that has continued, we are replacing lead pipes across the country to ensure kids and communities everywhere are safe. And that is a ripple effect of what happened in Flint. And there's so many more. The words environmental injustice, nobody talked about it in Flint. Now it is a common part of our nation's lexicon. People are paying attention to it. People are investing in it and protecting more of our vulnerable communities.
That's awesome. So the RX Kids program started. How is that going?
OMG! So RX Kids is one of the most exciting things that we were doing. So something that we've learned over the last few years, listening to our moms and our dads and our kids, also looking at the data that has come in from the registry and other data sources. Something that we have learned is that our Flint families are struggling. It is very hard for them to make ends meet. When I'm caring for a patient in clinic and I have a little newborn in my arms, and I'm doing everything I'm doing to protect them and to make sure that they grow up to be healthy, like giving them their vaccines and counseling them and talking about car seats and sleeping on their back, all these important things that we do as pediatricians. When I am holding that Flynn baby in my hand, I struggle because there's something that I cannot prescribe to make them as healthy as possible. I cannot prescribe an antidote to poverty. Our Flint is the poorest city in our state. It's one of the poorest cities in the country. When kids are born into and grow up in poverty, it impacts them forever. It's like a poison. It's like a virus that makes it really hard for them to grow up to be healthy and successful. It actually impacts their brain development, impacts how much food they have, and the stability of their housing and their family structure. Poverty is the root cause of so much of what ails us. And I was tired as a pediatrician not being able to do something about poverty. So RX Kids is this bold, crazy, never been done ever effort to prevent poverty when it's the worst. So we are going to be prescribing cash to every pregnant mom in Flint and every baby in Flint until they're 1 year old. Everybody, not just like 50 people or a handful of people, every pregnant mom and every baby in Flint starting in 2024 will be prescribed cash to prevent poverty, to improve equity, to provide hope and opportunity for our community.
How has the funding for that gone so far? Is there like ways you can gain funding from other communities or other people? That
is a great question, and that has been kind of where most of my effort has been put forth, is to try to raise money. So to give everybody cash, you need a lot of cash, right? But we're doing this in Flint for many reasons. Once again, Flint's the poorest city in our state. Flint's also a kind of small, big city. We only have about 1,000 babies born a year, but we also have this kind of academic community partnered infrastructure to do this. But because we only have like 1,000 babies per year, we don't need as much money if, say, we did this in Detroit to start. So that's why we're doing this, because we don't have to raise as much money. But we still need about $11 million a year. $9 million is going to be the cash that goes to pregnant moms and babies. Another $1 million is like for the research, and another $1 million is for the operations to do this program. So we need $11 million a year, and we want to be able to do this for at least 5 years of moms and babies. So 11 times 5 is 55. So we're trying to raise $55 million, which is like crazy, right? Yeah. Oh, sorry. But OMG, in less than a year, we've raised over $40 million. Wow. It's unreal. When I share this program to funders and to legislators and to donors, they're like, this makes so much sense. Like, this is exactly what we should be doing. For so long, we have been band-aiding problems, which means that we are reactive. We take care of things after the problem has already started. We invest more in like mental health resources and criminal justice and education programs, when really we should be investing in people and children before they have problems. One of my favorite quotes is by Frederick Douglass, so an abolitionist who over a century ago said, "It's easier to build strong children than to repair broken men." I'm going to say that again because I love this quote. It is easier to build strong children than to repair broken men. We often fail as a nation in prevention. We learned that with the Flint water crisis. We could have prevented the Flint water crisis. We could have done more to prevent COVID. We don't invest in public health. We don't invest in what makes people healthy. And this is why ARC's Kids is so exciting. We are investing in prevention. We are investing in building strong children. So we've raised about $40 million. The first kind of big chunk of money came from foundations, especially the Mott Foundation, which is based in Flint. They committed a $15 million challenge grant. They said, you have to raise another $15 million, then you can unlock that money. So that made us work really hard to raise that other money. And so lots of other foundations and donors have come in, but we received from the state of Michigan in the state budget, led by Senator John Cherry from our community, $16.5 million. So that was huge. It was the state saying, we believe in this project, we believe in you, we believe in Flint moms and babies, and we're gonna do this in Flint, but you have to prove it works, quickly so that we can spread it across the state. So we've been able to raise about $40 million. We have about $15 million to go. So viewers out there, go to flintarcskids.com if you want to contribute. And we're hoping to kind of close that gap soon. But the amount that we have raised ensures that we can launch this program. So we are launching this program in 2024. The public launch and celebration is going to be, you tell me, what's a day devoted to love?
Oh, is it Valentine's Day?
Yes, it's
awesome.
Valentine's Day. So we are launching this program on Valentine's Day 2024 because this is fundamentally about how we love each other, how we're supposed to care for each other. This is about preventing poverty, but it's also about sending a strong message to Flint moms and babies that we love you, we see you, we hear you, and there is this amazing village walking alongside you. And we're doing this project in Flint. We're not doing it anywhere else in the country. We're doing it in Flint because Flint's known for doing big things. We're known for, once again, standing up, doing hard things, and most importantly, protecting our kids.
That's so awesome.
It's so awesome. So save the date. Yeah. Valentine's Day is going to be
I love that.
It's going to be a bash.
Do you have any questions?
Yeah,
More
yeah,
questions
I
about
got it.
ours?
You're good.
Okay. That was like a good thing, and now it's just my next question is like looking back.
Yeah, no, that's okay.
Okay, I'll look despondent again.
I gotta say, like, maybe this is our question then. 10 years ago when you were putting this out there, and to see you then, right, very serious, getting that message out, and now it feels like you have hope. 10 years later.
Yeah, so the water crisis started 10 years ago, but like my involvement and the world did not know about it until like 2015, 2016. So the water crisis started April 2014. That's when that fateful button was pressed that changed our water under this kind of bizarre state of usurped democracy under emergency management. This terrible decision that was driven by austerity was made to change our water. And that went on for like a year and a half, despite the uproar of the people of Flint who knew something was wrong. I didn't get involved until like 2015, when I first heard that there was lead in water. And we didn't become a federal emergency until 2016. But from the moment of kind of recognizing the scope of what was happening, our work has been about tomorrow. It has been about ensuring that we have the brightest tomorrow possible. So it has always been about hope. It has always been about working hand in hand with our moms and our dads and our kids to mitigate the impact of this crisis and to be a model of hope. There's even a chapter in a book I wrote called Prescriptions for Hope. And that's what we have been doing, and that's what we continue to do. And really, ARCS Kids builds on that ability and that drive to deliver hope.
Wasn't always easy, was it?
It wasn't always easy, but I wouldn't have done it any other way. So yes, there was a lot of pushback. There was a lot of resistance. There was a lot of folks who wanted us to stay silent. When you are fighting for your kids, when you are fighting for a community of children, there is no other way than to keep going.
Okay, your personal ride. I mean, you go from being pediatrician at Flint to being the leader of this movement, right? Worldwide, almost fame, right?
Yes.
What was that like for you?
That's a great question. So, I was a pediatrician, an academic, a professor with Michigan State University, a busy mom, a busy wife, juggling a bazillion balls in the air, like so many folks do. And then the water crisis happened, and I was put in the spotlight, and have really continued to have this amazing microphone, which I consider a privilege to have a microphone, a platform to be able to advocate for not just our kids in Flint, but kids everywhere. So it has been surreal. My life these last few years has been nothing I would have anticipated. But I also feel that I was, almost kind of made for this moment. Like my training in pediatrics, I had training in advocacy and legislative training. I had another degree in health policy. I was almost the right person at the right place at the right time with the right team and the right, once again, education and training to be able to do this work. And I feel so, once again, privileged and blessed to be able to do this work. And it's not just me doing this work. Once again, it is a village in Flint and a village around the nation that is doing this work together to be able to elevate these stories. So often change happens in windows of opportunity. Policy, laws happen like in windows. Like people could be advocating to replace lead pipes. They've been advocating to replace lead pipes before I was born. But there was this window in our nation that we were able to get it done. So I had the chance to testify before Congress multiple times to share the Flint story and to share why we need to do this for the nation. So I put my hand up, and it's not always easy to put your hand up and to stand up. So something I would encourage to students and viewers out there is take advantage of those moments. You never know when they're going to happen. They're scary, my stomach hurts, my heart races, but put your hand up, raise your voice, take advantage of those moments to be able to do the right thing, and it's often hard, but for the right reasons.
Yeah. I think you hit all the bases today.
Anything else you want to add while we're here?
Me?
No,
Or-
no,
okay.
else.
Okay.
Yeah, you or her, either one.
No,
Chris?
just
I
just
think that's-
as much as we can share, kind of a positive that has come out, and that we're still doing lots of awesome positive things.
Yeah.
Awesome. Okay, we're gonna get one more thing. Can we get a cutaway shot? That walking down the hall shot.
Oh, yeah.
Okay.
The B-roll.
Take
Can I
it
take
like